So, my group had supported decision making, and this just means it's giving people the help they need to understand their options and make their own choices. So, for people with disabilities, this supports may be tailored, and the goal is to promote independence and self advocacy. And this approach empowers adults with intellectual and developmental disabilities to make their own choices and exercise autonomy in various aspects of their lives. And it just allows individuals with IDD to retain their decision making capacity by choosing trusted supporters to help make their choices. So, overall, it just recognizes that adults with IDD have the right to make choices about their lives, including healthcare, finances, and personal matters. So, some key aspects are that the individual with the disability can select trusted advisors, such as friends, family members, or professionals to serve as their supporters. So, just basically, I feel like anybody in their inner circle, and those supporters agree to help the person understand, consider, and communicate decisions. The person with a disability makes the final decision, not the supporter. So that's very important to remember. It can also be used in various areas of life, including healthcare, employment, relationships, and finances. The SDM aims to protect self determination, control, and autonomy for individuals with disabilities. It can be formalized through a supported decision making agreement, which then outlines the areas where support is needed and how it should be provided by those supporters.
Hi everyone, my name is Andy. I'm a DPT student, and in regard to supportive decision making in adults with intellectual and developmental disabilities, or IDD, I'm going to be discussing the principles, benefits, and the strategies to go about that. So, when it comes to the principles for supportive decision making, there's 8 key principles, and they can be broken down into 3 categories, being autonomy, support, and capacity. So, for the principles that are related to autonomy, we have respect for autonomy and self determination, and that's facilitated through supportive decision making. There's a person centered approach, which is going to focus on an individual's preferences, values, and goals. And then there's also going to be the least restrictive alternative, which is kind of like providing the minimal level of support necessary for someone to make their own decision. So for the principles that are related to support, one is going to be it's a collaborative process, so that'll involve the individual as well as any of their trusted supporters and the professionals that are involved in their care. The next principle is going to be flexible and individualized support, which is just a way of providing support that's tailored to an individual's needs or their specific decision. And the last principle is going to be the legal recognition of supported networks. So that just recognizes decision making as a shared process and gives formal standings to the supporters for the individual. All right, and finally, for the principles that are related to capacity, we have one being the presumption of capacity, which is just the belief that an individual has the capacity to make their own decisions, regardless of their cognitive ability. And then capacity building, which is just the enhancement of an individual's decision making skills over time with practice. So, when it comes to the benefits of supporting individuals with IDD through supportive decision making, they really relate back to those 8 key principles. So, there's a promotion of self determination and autonomy. It enhances their quality of life and can help develop their decision making skills. It protects their civil rights and reduces risks of abuse and neglect. It helps them develop their communication and understanding. It'll increase their community participation. It can avoid costly legal processes, and it enhances their overall self esteem and confidence. So, there's various different strategies that one can use to go about facilitating supportive decision making in those with IDD. Some examples of those would be identifying supporters and developing a support network, using accessible communication for the individual and helping them break down complex decisions. And then you could also help them explore options related to that decision. And then you also want to encourage them to practice their decision making skills, respect their preferences in all decisions that are made, and all in all, just document the process.
Next, we have ethical and legal considerations. When implementing supported decision making, it is essential to understand the ethical and legal aspects. First, we have legal consideration. This is familiarizing yourself with local laws regarding supported decision making agreements. Next, we have informed consent. This is ensuring the individual understands the nature and the consequences of their decision making. So, when you are working with a patient, you want to make sure you're as transparent as possible. This includes the good, the bad, the ugly, as well as the outcome of their decision. Next, we have conflict of interest. This is a potential conflict between the support and individuals' preferences. Supporters can be people such as family, caregivers, doctors, therapists. Next, we have privacy and confidentiality. This is to respect the individual's right in decision-making processes. Lastly, we have safeguards. This is implemented to protect against undue influences and exploitation. Collaboration with healthcare professionals. Healthcare providers play a crucial role in supporting decision-making for adults with IDD. First, we need to recognize capacity. This is to assume that the individual has decision-making capacity unless proven otherwise. Next, provide accessible information. So use plain language and visual aids to explain medical information. It's easy for us as providers to go on a tangent with our medical terminology and abbreviations, but for them, they have no idea what we are talking about. So it's important for us to break it down in a way that they can understand it. Involve supporters. This is very important. It is to include trusted individuals in healthcare discussions with patients' consent. Trusted individual, it could be a friend, a partner, a family member, a caregiver. Allow time. Give individuals with IDD extra time to process the information and make their decision. And then lastly, document preferences. Record the individual's healthcare choices and decision-making process.
Hi, my name is Isabel Griswold. I'm the PA, a part of this group, and I was in charge of doing the additional questions. So first, to introduce the questions, they were how can we determine what the relationship may be between a caregiver and patient, and in an emergency where an obvious guardian is not present and a disability is not confirmed, how do you go about communicating with people who are having difficulty in order to provide compassionate care and receive consent? So the first question I'm going to address is how can we determine what the relationship may be between caregiver and patient? So in the paper Supporting Adults with Intellectual and Developmental Disabilities to Participate in Healthcare Decision Making by Sullivan and Hang emphasize that adults with intellectual and developmental disorders should not be presumed incapable until they demonstrate they are. Just because someone is living with intellectual disabilities does not mean that they are not able to make their own informed decisions within their own lives. So approach the patient assuming that they're of capacity. This would look like talking to the patient directly and seeing how they would react with certain questions they are asked, looking to see if they turn to their provider, to their caregiver in times like this, seeing what questions they are capable of responding to, and seeing if they need any additional support. So the next step would be to identify support versus decision making. And supported decision making allows individuals to select trusted people to assist them in understanding and communicating decisions. In the end, the individual has the final say in what their decision is. In Sullivan and Hang, they describe supported decision making as collaborative input between the patient and the guardian. So this would be making sure that they are having conversation and not just the guardian taking over and trying to make decisions for them, and making sure this is a collaborative effort instead of just the guardian trying to take control. And the last one is to be aware of influence from the guardian. So Bigby discussed that providers should be aware of how the information is being presented to the patient and be able to distinguish bias versus facts on how the guardian feels. So making sure that the guardian is presenting the information that you were giving them and making sure that the guardian is not being biased in their information that they are presenting to them and that it is straight facts instead of trying to portray something and make the patient pick a certain thing over the other. The last question I'm going to address is, in an emergency situation where an obvious guardian is not present and a disability is not confirmed, how do you go about communicating with people who are having difficulty in order to provide compassionate care and receive consent? So the first thing to remember is that when a disability is not confirmed and that there is no guardian, is to always maximize autonomy and making sure they have their full rights. So within Sullivan and Hang, they emphasize that decision making is usually task dependent and may not always need a guardian to consent. So for in this instance, maybe a patient with an intellectual disability shows up in the emergency department with no guardian and they need wound care or they need IV fluids. So they may not always need a guardian to help them understand the implications of this. So supported decision-making model highlights this by emphasizing accommodations rather than assuming they are not capable of decision-making. So for good communication within these patients or within any patient is to understand their understanding level and to make sure you use as much plain language as possible. So avoiding medical jargon, making sure you're using different forms of visualizations and different forms of ways that they can understand things, and making sure to use plain language as much as possible. And this is super necessary. And within emergency, implied consent is sometimes needed within an emergency situation. So supported decision-making principles also highlight that this is important to not assume someone is incapable without making accommodations. So like I said before, making sure we're using plain language, no medical jargons, making sure to use visualizations as much as possible or different forms of understanding. So when is implied consent appropriate? So when there's no guardian present, delaying care would cause harm, or patient lacks decision-making abilities. But remember again that you never want to assume somebody is not able to make their own informed decisions even though they are living with a disability. So Agarnick highlights that people with disabilities often feel that they are left out of their own decision-making for their health by the providers. So again, this highlights that it is important to bridge the gap even in emergency situations by never assuming someone is not capable of making their own decisions.
In summary, supported decision-making is an important approach that promotes autonomy and self-determination for individuals with intellectual and developmental disabilities. This is also known as IDD. By using intentional strategies and respecting individuals' rights to make their own choices, healthcare providers and support systems can help adults with IDD actively participate in their own decisions about their lives and healthcare. As awareness of self-determination grows, supported decision-making remains essential for empowering adults with IDD to exercise their rights and make meaningful person-centered decisions.